that day when you had the stroke, what were you doing when you initially noticed the symptoms?
Well, I can tell you I was doing something legitimate. I was working quite hard. I usually work quite hard. We have a large property, and I have 3 gardens around the property, among other things. And there's lots of work in the house, a lot of wood there and things like that. So I would have been basically doing that and aiming to finish up for the day and have something to eat. I turned to my wife, who had followed me, thinking I was intoxicated. She said, "I thought you were drunk," but she didn't know what I was, so it was very unusual. And basically I said, "Janet, I'm not well." The word I used is not well. So in any event, that got things moving, and I wasn't aware when the ambulance did come. If I was aware, I don't remember.
About 25% of patients, so that is 1 in 4 individual having a severe stroke, they succumb to the stroke. Fortunately, if the patient arrives early or the individual arrives early, we have a lot of treatment options available. It includes blood thinners, include strong clot busting medication to dissolve the brain clot. Sometimes the clots are very big and these medication may not work. In those cases, we can do a special procedure. It's a surgical procedure called EVT, or endovascular thrombectomy. We basically introduce a catheter through the groin all the way up into the brain, and then we apply either a suction or we remove the brain clot to reestablish the flow. And sometimes when we do these procedures, the improvement is remarkable. Why not medium or smaller size clot? So that is the second question we were trying to address in the trial called Escape-MeVO trial. Andre was part of this trial. And what this trial was trying to achieve was trying to see if we can improve patient outcome if we do EVT on top of the standard of care. Basically, the trial showed that there was no superiority of offering EVT over standard of care. And now what it impacts even beyond Andre is how we design or arrange our care in the entire Northeast. Now we learned that patients with a medium vessel occlusion doesn't have to be transported or transferred to Health Sciences North. They can receive the standard care closer to their home. It also has a huge system level impact that we don't have to now move patients around and away from their families, and they can complete their recovery closer to their home. So this trial, although superficially a neutral trial, has a huge system and individual level impact. And the impact goes beyond that individual who participated in the clinical trial, because it informs of how we care patients with stroke moving forward.
Being involved in research is more than just about data and timelines. It's about connecting science with humanity, ensuring that every patient's care in research is guided by trust, respect, and care.
Each patient who volunteers helps answer important questions that can shape how we treat stroke in the future. It takes a community to move research forward for everyone.